So we are at question 21. We said, as question 21, section A, the network is really misbehaving. I don't really know why. When we say a band is of partial thickness, what do we mean? Now, when we say a band, there are three layers of the skin, right? We have the epidermis, the dermis, the subcutaneous layer of the skin, and most often at time, when you say something is of partial thickness, it means it affects the external layer of the body, like waterborne. It mostly affects the external layer of the skin, that's the epidermis of the skin. So when it's of partial thickness, it means it involves only the epidermis alone. That's what you should understand. Since we say there are three layers of the skin, there are four layers. The sebaceous, there are three layers of the skin. We have the epidermis, the dermis, and the subcutaneous layer. Right. So the right answer to that question is going to be C. Right. When we say pen is of partial thickness, we mean it involves only the epidermis alone. Right. And then question 23. Dash involve a bend in which the both arms are involved and the abdomen. Calculate the percentage using the rule of 9. Calculate using the rule of 9. Should I calculate that? The rule of 9 is something that is really good that you guys calculate. But I'll just give an example. When you calculate, tell me your answer. We'll compare with the answers that we have there. So this patient, question 20, this patient is admitted into the ward. He has type 1 diabetes mellitus. Laboratory investigation indicates ketones in blood, and upon examination, his breast gave a fruity semen. What will be the suspect? Right, what will be the suspect? Now, we have noted that the person, first of all, has type 1 diabetes mellitus, and upon examination, they noticed that ketones were found in the urine of in the blood of the patient, and his breast has a fruity semen. What will you suspect? Hypoglycemia, hyperglycemia, ketoacidosis, metabolic acidosis. You see, so the answer is just very clear. The ketoacidosis, diabetic ketoacidosis. When ketones are found in blood, it makes the physician understand that the entire body system is having an issue. Why? Because when there's a disease condition beside that has accompanied diabetes mellitus, you start seeing ketones in urine. You hardly see ketones in blood or in urine of a diabetic patient. But now when you start seeing it makes us to understand that the alkaline nature, that the pH nature of the body has changed. And for ketones to appear in urine, it means the body system is acidic. That's why you see that word ketoacidosis, diabetic ketoacidosis, right? So, question 24, it is a drug to treat vaginal candida. Doxycycline is a tetracycline. Penicillin, that's penicillin. Cipro is a fluoroquinolone, and then D, fluconazole. Fluconazole is the only antifungal drug there. So that's the right answer. Question D. An example of a beta blocker for the treatment of hypertension. A beta blocker. Yes, a beta blocker. Any word, any drug that you see ending with nolol, olol. That's what beta blockers are. Then when you see any drug ending with diazide, it's a diuretic, furosemide, hydrochlorothiazide, and all of that. So we see the beta blocker is propranolol. So that's it. We are done with the MCQ part, except that somebody asks a question. And I also forgot to say that now, when we look carefully at 2021, the question that came in 2020, you notice that there were some quiz systems that came We saw questions in the digestive system, pathology of the digestive system. We saw questions came from diseases of the circulatory system and blood, right? So take note of them. Each system that we revise, try to think and go back and say, this system like this, where did the questions come? Now we are seeing a bit of tuition with the MCQ part, so let's continue to go to section B and see how it's gonna be. So, question as the B part. Following signs and symptoms are common with esophageal disorder. Briefly indicate what each of them mean. Hemat, hemat, emesis, hemat emesis. What does that mean? Hemat emesis means like vomiting mucoids that is accompanied with blood. Mucoids that is accompanied with blood, or vomiting that is accompanied with blood. It can occur as a result of an upper gastrointestinal tract infection, or a wound or a bruise that occur, and also gastritis. Also, you can also see that with gastritis, chronic gastritis or an acute gastritis, right? Then melena, just like we said, melena is a medical term for a dark, starey stool, right? That is caused by bleeding in the upper part of the GIT, right? A black starey stool is caused by bleeding in the upper part of the GIT, such as the esophagus, the duodenum, and even the stomach, right? Occurred blood. Occurred blood is an invisible, is a medical term for an invisible or a hidden, from the word occurred. Occurred means hidden. All right. Occurred blood is a hidden blood that is found in stool that is not visible with the naked eye. So occurred means hidden, and I want to look at occurred blood, mean an invisible blood that cannot be seen with the naked eyes, found in stool. It can only be diagnosed by in the lab, and most often at time it occurs as a result of bowel an inflammatory bowel disease. Then the next word is, that's the pyrosis. Pyrosis is also known as heartburn. There are so many names for that, right? It's also known as heartburn, right? You can call it heartburn, you can call it indigestion, you can call it acid regurgitation, you can call it beta virgin, right? That's another name for pyrosis. Pyrosis, and it is a burning sensation caused by stomach acid, which leaves the stomach to the esophagus. Take note of that. It is a burning sensation caused by hydrochloric acid or the stomach acid, which leaves the stomach to the esophagus. All right. Odinophalgia. Odinophalgia is a medical term for painful swallowing in the throat, right? For painful swallowing in the throat. It can be caused maybe by painful swallowing in the throat, like people that experience sore throat. They are fond of going through that. So we are doing question one. Question two. A young male student of 25 years old is admitted into your ward with a diagnosis of peptic ulcer. What is peptic ulcer? Take note of that. What is peptic ulcer? B. Where are they commonly found? C. How are they called? D. Differentiate between them. You notice something very tricky about this question. When you see A, they say what is peptic ulcer. They say what are they commonly found? Where are they commonly found? They are mainly telling you that there are types of pep. There are types of peptic ulcer that are found in various parts of the body, and they say how are they called? The moment you missed B, you will fail C. Now, if you miss B and your answer in C is correct, it means that you have stolen the answer. So that's how examiners trap students. So, what is peptic ulcer? 2 marks. 2 marks. Where are they commonly found? Right. Peptic ulcer are erosion or inflammatory, or we can just say wounds or inflammation of the mucosal linings of the stomach and the duodenum, which result from the action of stomach acid. Right, we are saying it is due to inflammatory response, or it's a result of inflammation of the mucosal linings of the stomach, or erosion of the mucosal linings of the stomach. And they are of two various types. We have gastric ulcer, and we have duodenal ulcer. We are saying where are they found? They are found in the stomach and they are found in the duodenum. And we are saying how are they called? They are also called gastric ulcer, and we have duodenal ulcer. Duodenal ulcer because it's found in the duodenum. They say we should differentiate between the two of them. Something so tricky. How can we differentiate between duodenal ulcer? The first thing is their location, where they are found, right? Where they are found. And also with duodenal ulcer is common with melena, dark stary stool. But with gastric ulcer, you may not find dark stary stool. You may also find vomiting. You may find hemet, hemet, hemesis, that's bleeding, vomiting with blood in gastric ulcer, right? Now with gastric ulcer, immediately as you eat, you may feel pain. You may start feeling, you may reduce, the pain will subside, but instead with duodenal ulcer, as you're eating, you'll be feeling pain. There are so many differences. I will send a picture to you guys so that you guys can learn and see the differences there. It's coming from my notes. Those are, we don't even have light here and my laptop is off. So the next is differentiate, and that question is giving 4 marks. You understand the location. You say this is found here, this is found here, this is like this is like this. Just like that, you have your marks. You see pain after food, that's gastric ulcer. Pain before food intake is peptic ulcer. Periodic is periodical. Periodic means like how often, is more common, right? And then for peptic ulcer is more common, more common. Peptic ulcer is more common than gastric ulcer. The issue of vomiting blood in gastric ulcer is more common than it's more common. Why in a duodenal ulcer you have things like melena, dark stary stool, right? The dark stary stool is more common. In gastric ulcer you have weight loss, but in peptic ulcer you have weight gain instead, right? Now gas gastric ulcer occur in both males and female, while in duodenal ulcer occur mostly in men. So that's it.